Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm, a former surgeon and presently chairman of the Isle of Man Anti-Cancer Association.
And my name's Sandy and I'm the executive officer of the association and a cancer survivor. In this podcast we want to raise lymphoma awareness. Lymphomas are a group of cancers that arise from cells called lymphocytes within the lymphatic system. People often get lymphoma and leukemia confused, although they do have similar sounding names and both arise from white cells. In lymphoma, the abnormal cells are largely confined to the lymphatic system, whereas in leukemia, the abnormal cells develop in the bone marrow and are present in the bloodstream.
The lymphatic system is a complex network of fine vessels within our bodies. This network of vessels drains a clear fluid called lymph from the body's tissues back into the bloodstream. In our guts, it is also the channels through which fat is taken up into our bodies. The lymphatic system is a vital part of the body's immune system, helping to protect us from infection and disease. There are groups of lymph nodes, also known as lymph glands, around the network. As the lymphatic fluid passes through the nodes, they filter out abnormal cells and germs, both bacteria and viruses. The lymph nodes contain infection-fighting white blood cells called lymphocytes. These lymph nodes often swell when they are fighting infection. If you have a throat infection, you may be able to feel slightly tender, swollen lymph nodes in your neck or just below your jaw. We also have a number of lymphatic organs, principally the spleen and the tonsils, and behind the sternum the thymus, which helps some types of lymphocytes to mature, particularly in our younger years.
There are several types of lymphoma, but the two main types are called Hodgkin's and non-Hodgkin's lymphoma. Hodgkin's lymphoma affects about 1,700 people in the UK annually, with peaks in incidence between the ages of 20 to 34 and again at 70 to 79. With the disease arising in lymph nodes, usually in the neck. Interestingly, Hodgkin's lymphoma, originally called Hodgkin's disease, was one of the first cancers to be treated with chemotherapy with remarkable results. Non-Hodgkin's lymphoma, of which there are many subtypes, is the fifth commonest type of cancer, affecting some 10 to 12 island residents every year. Its incidence is strongly age-related, being highest in the elderly. It usually also arises in lymph nodes, but can start in extranodal sites almost anywhere in the body, including the stomach, small bowel, skin, tonsils, thyroid and testicles.
The most common early symptom of lymphomas is a painless swelling of the lymph nodes in one area of the body, such as in the neck, in the armpit or groin. Some people can experience a slight aching sensation in these enlarged nodes. Other general symptoms can include frequent, often drenching sweats, especially at night, high temperatures that come and go without any obvious cause, unexplained weight loss, tiredness, and itching of the skin that doesn't go away. Symptoms may also occur depending on where the lymphoma is situated in the body, such as a cough, difficulty in swallowing or breathlessness, indigestion or tummy pain, difficulty in fighting infections, and bruising or bleeding.
There are some risk factors associated with development of lymphomas. There is a very slight increase in risk of developing lymphoma if you smoke or are overweight, have had glandular fever, have a weak immune system, or have had a close relative who's had lymphoma. However, the increased risk is very small with any of these factors.
What should you do if you are worried that you might have a lymphoma? As we always say, if you're concerned about any possible symptoms, the first step is to talk to your GP. It's best to get things checked out. There are many simple causes for swollen lymph glands, but if you do have a lymphoma, early treatment will allow you to get back to your normal life pattern more quickly.
So please remember the key symptoms. A painless swelling of the lymph nodes in one area of the body, especially the neck, but also the armpit or groin. Frequent, often drenching sweats, especially at night. High temperatures that come and go without any obvious cause. Unexplained weight loss. Tiredness and itching of the skin that doesn't go away.
There is a lot of good information available about lymphomas, at cancerresearchuk.org or macmillan.org.uk. You can also visit the Macmillan Cancer Information Centre at Nobles Hospital or contact them on 650 735 or look at their website at macmillan.org.uk. Thank you for listening.